Hernia. Hernia is the protrusion of viscous organ or a part of viscous organ through a weak opening. And there are different types of hernia, among which inguinal is the most common type, which constitute about 73%. Then the second most common type is the femoral, then the umbilical. And remaining all types of hernia are very rare and usually constitute about only 1.5% of the hernia. And the different other types of hernia can be epigastric, incisional, paraumbilical, spogelian, Richter, lumbar, phantom hernia or Litter's hernia. Before going to detail about all these types of hernia, we should know the key words or the key site of all these types of hernia. Actually, the inguinal hernia is seen in the inguinal canal, and inguinal canal is the canal which connects the superficial inguinal ring with the deep inguinal ring. Actually, this superficial inguinal ring is situated just 1.25 centimeter above the pubic tubercle, whereas the deep inguinal ring is present just in the midpoint of anterior superior iliac spine and pubic symphysis. And the shape of the superficial inguinal ring is triangular as shown in the figure, whereas the deep inguinal ring is U-shaped. We will be looking in deep inguinal ring for the indirect type of inguinal hernia, whereas the direct type of inguinal hernia directly comes from the Hasselbeck triangle, which we will look in further in detail. Then the femoral hernia, which is usually originated from the femoral canal, which is present in the medial part of the femoral sheath. This is all the femoral sheath, which is composed of femoral canal, femoral vein, nerve, artery. And in the medial compartment of this sheath there is femoral canal, and this femoral canal usually originates from the femoral ring to the saphenous opening, and we will be looking for the femoral hernia at the site of saphenous opening, which is 4 centimeter below and lateral to the pubic tubercle. Okay, this is the site where we will be looking for the femoral hernia. Now the epigastric type of hernia, it is usually can be present from the xiphoid process to the umbilicus. It is due to the defect in the linea alba, means it is usually present in the midline, which can be present anywhere in between xiphoid process to the umbilicus, and due to the defect in the linea alba. Okay, then the incisional, as the name suggests, it is usually seen at the site of the surgical incision scar. Then the umbilical is exactly at the side of the umbilicus and usually seen in case of children and infant who suffers from neonatal sepsis, child and infant. Then the paraumbilical, it can be either up or down to the umbilicus, and usually due to the defect in the linea alba. Again, this is also due to the defect in the because the herniation is usually through the linea alba. Then the spogelian, this might be new for you because spogelian type of hernia is exactly seen in the arcuate line, which is a semicircular type of line, which is drawn from the about means first of all spogelian. How to remember this? S is for the semilunar line. We will draw semilunar line. okay, and this line is drawn from the pubic tubercle to the tip of a ninth intercostal cartilage. Semilunar line will be drawn from the ninth intercostal cartilage to the pubic tubercle, and if there is any hernia in this line, then that will be called as spogelian type of hernia. And usually 90% of the cases this hernia is present below the umbilicus. Then the small types which is usually asked in MCQ is the Richter type of hernia. In Richter hernia there is only a certain circumference of the bowel is involved in herniation, not the whole bowel wall is involved. If only certain circumference of the bowel loop is involved in hernia, that is called as Richter. And lumbar hernia can be either from the superior or inferior lumbar triangle. So this is a very rare type of hernia. Then the phantom hernia. Phantom hernia is due to the muscle bulge. Due to the paralysis of the muscle, there will be bulging of the muscle and will be seen as a hernia, and means phantom is for the muscle bulging as a result of local muscular paralysis and may be due to poliomyelitis. Okay, phantom. Then the Letters is the hernia of the Meckel's diverticulum. So I think that these were the new types of hernia, like spogelian, which was a semilunar shaped line was drawn, which started from the ninth intercostal cartilage and ends to the pubic tubercle. And if the hernia is present in this line, that will be called as spogelian. Then the Richter, we saw that the Richter is when the herniation of only certain circumference of the bowel loop is involved, then we will call it as Richter hernia. Lumbar can be either in anterior or posterior lumbar triangle. Phantom is due to the muscular bulge, usually post to the paralysis of the muscle. Then the Letters type of hernia, usually seen in case of Meckel's diverticulum. Now we will start inguinal hernia. Inguinal hernia is divided into two types, that is direct and indirect. Among these, which do you think is more common? That is the indirect type of inguinal hernia. Okay, so first of all we will correlate both type of hernia, starting from indirect type. Indirect and opposite will be applicable for direct. Okay, now as I said earlier, first of all we will start from the incidence or general introduction. Under general introduction we will look that we should know that indirect type of hernia is seen in usually young person. Young में indirect होता है. Then direct is usually in elder. Then it is more common. About 65% of the hernia, total hernia, is due to indirect type, whereas direct is somewhat less common than this is second most common. Then what is the site where we will be looking for indirect? It is the deep inguinal ring, and as I said earlier, deep inguinal ring is present at the midpoint of the ascis and means anterior superior iliac spine and pubic symphysis. Then the direct is seen as the Hasselbeck triangle. Hasselbeck triangle is the triangle between it can be remembered as REL. R is for the medial side, whereas E is the lateral and L is the lowermost. R is the rectus abdominis muscle, E is the inferior epigastric artery, and this is the inguinal ligament. So in direct hernia, the protrusion of the viscous organ is via the Hasselbeck triangle. Then then the types of the indirect hernia. There are usually 3 types of hernia, indirect hernia, that is according to the descent of the sac. Means if the sac of the hernia is limited to the inguinal ring, inguinal canal, then that will be called as bulbonocele. And if the content has descended up to the testes, but the testes and the sac can easily be separated, that will be called as funicular. And if testes and the sac of the hernia appears as a single swelling, then that is called as complete type of hernia. Whereas the direct type of inguinal hernia is divided into medial and lateral according to their site, whether they are medial to the umbilical ligament, it is medial, or lateral in relation to the umbilical inguinal ligament. It can be medial or lateral. Then we should know about some of the clinical feature. Usually they both are similar in case of means the presentation is can be either dragging type of pain, there can be swelling, and the swelling is usually descended up to the scrotum in case of indirect. Whereas indirect, it do not descend up to the scrotum. Okay, then the other 3 important tests which are usually performed to distinguish among these tests are the ring occlusion test, then the ring invagination test, and the last is the Zeeman test. So in ring occlusion test, the swelling does not appear on the occlusion and reappears on releasing the thumb in case of the indirect hernia, whereas in these are the signs which we will be discussing in the examination of the hernia. Okay, so these are used for the diagnosis of both of these to differentiate among the indirect and direct. Then some of the investigation which we will send for the diagnosis will be chest x-ray to rule out chronic bronchitis and TB. We will also send ultrasonography of abdomen, and some of the relevant specific precipitating cause. Means hernia is usually caused due to strenuous or valsalva or any cough, constipation. They are the predisposing factor, no? So we should also look for the underlying cause, that is cause for the straining. Okay, so we need to manage that also. And at last, the treatment modality. For the treatment modality, it varies according to the age of the patient. If the patient is infant, for the infant we will directly perform herniotomy, that is excision of the sac. Herniotomy, it is just the excision of the sac, usually done by the method of Michaelis plank operation. Whereas if it is the case of adult, then along with herniotomy we have to perform herniotomy should be performed along with hernioplasty. And there are different method of hernioplasty, that is the repair of the hernia. Hernioplasty means usually this is done by the help of propylene mace. Either it can be, this hernioplasty can be done by putting a mace made up of polypropylene. Polypropylene is a mace which can be kept either above or below the conjoint tendon, and if we are putting it above the conjoint tendon, that will be called as onlay, and if we are putting it below the rectus abdominis muscle, that will be called as inlay type of hernioplasty. So some of the, and for the hernioplasty we have different approach for the different patient, and some of the approach we should remember the name of the approach. It can be either Bassini repair or Soldis repair. The approach name is Bassini repair or Soldis repair. Okay, and at last, if the patient is not compatible to anesthesia and surgery, we can also go for conservative treatment, and conservatively we can do either taxis or TROS. There are two methods, taxis or TROS. So this is all about the indirect type of hernia. Then we should differentiate it from the indirect. Means, as I said earlier, that the types can be either medial or lateral, and there is no scrotal swelling in case of direct, and the site where we will be looking for the direct hernia is at the region of the deep inguinal ring. Deep inguinal ring. Actually, deep inguinal ring is here, so we will be looking at the superficial inguinal ring, opposite side. Superficial inguinal ring. And then the surgery, as we performed the excision of the sac in both infant as well as adult, there is no necessity of excising the sac in case of the direct. Okay, and remaining all the presentation and investigation will be similar as performed in the indirect type. But the treatment modality, in the treatment modality there is no importance of excision of the sac. Directly hernioplasty with the mesh repair can be done. Hernioplasty can be performed in this patient, so there was no sac removal. So once again I will repeat the different points or the difference between both of these. Look, first of all, the indirect is present in young patient, whereas this is in elder patient. Then usually indirect type of hernia usually presents in occur with pre-existing sac. Okay, whereas means this can be the sac can be present from earlier, whereas the direct type is always present as a acquired defect. Then the protrusion is through the deep ring in indirect, whereas it is through superficial inguinal ring in case of direct. Then there can be complete scrotum, means the descent can be completely up to the scrotum in case of indirect, where there is no scrotal descent in case of direct. Then the usually the sac is usually means the hernial sac is posterior to the cord in case of direct, posterior to cord, whereas the sac is usually anterior to cord in case of indirect. And the neck of the sac is medial to inferior epigastric artery, medial to inferior epigastric artery. And most commonly the direct hernia is usually bilateral. Okay, so these were some of the difference between the direct and indirect. Now we will go for the femoral hernia. As I said earlier, the site where we will be looking for the sac of the femoral hernia will be the saphenous opening, which is situated just 4 cm below and lateral to the pubic tubercle. And in the femoral canal usually starts from the femoral ring to the saphenous opening. And for femoral we should also remember that it is more common in, as we saw that the inguinal was more common in male, but the femoral is more common in female. It is about female is to male का जो ratio होता है that is 2:1 का. Then the other point should be like the swelling is usually present below and lateral to the pubic tubercle, as it is the site of saphenous opening. Then the treatment modality of the femoral is the can be remembered as LML. 2 times LML is there. So the surgical treatment will be Lockwood surgery, McEvedy surgery, Lothisen surgery. Actually this is Lothisen surgery. Then the other can be mesh repair, LML, with again LML will start with as a laparoscopic repair can be done, and mesh repair can be done. So these are different modality that can be performed to repair the femoral. And usually the pathology of the femoral hernia is like this: hernial sac descend down through the femoral canal vertically up to the saphenous opening and then escape out into the loose areolar tissue to expand out like a retort. Okay, so this is the pathology. Then we will just the minor type of hernia are remaining, starting from the epigastric hernia. Epigastric is due to the defect in the linea alba. Linea alba में what is the defect? Means defect in the decussation of the fiber in the linea alba. It will cause protrusion of the viscous organ out, and usually it is present in a midline from the xiphoid process to the umbilicus. Okay, and it is due to the defect in linea alba. अल्वा का जो फाइबर होता है उसका डेकुसेशन में अगर डिफेक्ट हो जाए दैट विल कॉज्ड दिस. देन एक्चुअली दिस इज अ sac. There is no sac in case of epigastric hernia, and the swelling is midline as the name suggests. It is the epigastric region, and the treatment will be sac is approached through a vertical incision, and the defect is usually closed by the non-absorbable suture. Just the repair is performed in case of epigastric. Then the incisional type, as the name suggests, incisional type of hernia is seen exactly at the site of the incisional incision during the surgery, and usually they can be seen in the first 5 years. 70% of the incisional hernia is seen in first 5 year. Okay, 5 year के period में they are usually seen, and some of there must be some predisposing factor for them for the incisional hernia. Means suppose that there is vertical scar present, or any major surgery have been done there, emergency surgery was conducted, and there can be also some of the straining factor like coughing, wheezing, or recurrent constipation or continuous straining history should be present. So there is just we need to repair these incisional hernia with the different types of surgery. They can be mesh repair, laparoscopic mesh repair can also be done, double bisting of the rectus sheath can be done, mesh, laparoscopic mesh, or we can also go for double bisting of the rectus abdominis muscle. Okay, so these were some of the modality to repair the incisional type of hernia. Then the umbilical. As I said earlier, umbilical is usually seen in case of child or infant. This is very much common, usually when they are affected by neonatal sepsis. Okay, and this is more common in case of male. Usually male is to female का जो ratio है that is 2:1, and then associated with, as I said, that it is associated with sepsis, or it can be associated with Downs and Beckwith-Wiedemann syndrome, which is present in the Wilms tumor, Beckwith-Wiedemann. So the first point one should remember it is due to the weak umbilical scar, usually seen in child and infant, and usually associated with Downs, Beckwith, or neonatal sepsis, and most common in more common in case of male. And then the treatment modality, almost 95% of the umbilical hernia resolves itself, spontaneous resolution. So there is no any importance of treatment modality, and it usually resolves after a few months of birth, after birth. And but if it do not repair even after the 2 years, or if the hernia is more than 2 centimeter, then these are the criteria for which we will go for surgical repair. And surgical repair, again we will go for the either mesh repair or laparoscopic mesh repair, or we can also go for Mayo's operation. Okay, and in a very severe case we may also have to go for umbilectomy with the repair by the mesh. So this was the umbilical type. Now very small topics or the hernia are remaining, that is the para-umbilical, that can be either above or below the umbilicus, and usually this is also the defect in the rectus abdominis. And actually linea alba, दिस इज लीनिया ऑल्बा का डिफेक्ट है, जिसके कारण अम्बिलिकस के ऊपर हर्निया हो सकता है और द हर्निया कैन बी आइदर बिलो. दिस इज ऑल्सो मोर कॉमन इन फीमेल, मीन्स फीमेल इज टू मेल का जो रेशियो है दैट इज 5:1. एंड usually these patient usually always require surgical repair for the require surgery for their treatment, and often they need dissection of the umbilical sac with the placement of the mesh in rectus abdominis. Okay, they need resection of sac plus mesh repair. Then this is all about the paraumbilical. Spogelian, as I said earlier, that the spogelian is the semilunar line which is drawn from the 9th intercostal space to the pubic tubercle, and if the hernia is present in this line, and then that will be called as the spogelian hernia. And usually the hernial sac lies deep to the internal oblique muscle. In spogelian, internal oblique muscle के deeper part में there is the hernia. Okay, means the sac is deeper to the internal oblique muscle, and about 90% of the spogelian hernia is below the umbilicus. And usually there should be some of the precipitating factor. This is also more common in female, and the female is among more than 50 years of age are more prone to have a spogelian hernia. Okay, and usually they also need surgical repair for the reduction of the sac, along with the repair by the suture, by suturing or by using mesh. Okay, so this was for the spogelian. The very small topic, that is Richter. Richter type of hernia. Richter का ये जो C है, if we can remember this C is for the circumference of intestinal loop. Only a certain circumference of the intestinal loop is herniated in case of the Richter. Okay, it mimics as gastroenteritis. Okay, this patient mimics as gastroenteritis, and with the feature of abdominal pain, diarrhea, vomiting, and systemic toxicity. There is no any feature of abdominal obstruction. And the treatment modality will be resection and anastomosis. Okay, and then the other was the phantom type of hernia. Phantom, and the phantom can be remembered as this M is for the muscle defect, and the muscle defect के कारण muscle bulging होता है. It is usually due to the paralysis which can be after पोलियोमाइलाइटिस. ओके, पोलियो के कारण मसल का पैरालिसिस हुआ, जिसके कारण देर इज मसल बल्जिंग which will cause hernia, and that will be called as the phantom type of hernia. The last hernia is for the Leiter's type, and Leiter's hernia is the herniation of the Meckel's diverticulum. So these are the different types of hernia. Thank you.